Dr. Vijaybhasker, Dr. Vijaybhasker, Masters in Orthopedic. Today we will discuss about the fracture. Fracture is the breach in continuity of the bone. The bone is the main structure in the human body which gives a physical shape and it maintains a physiological locomotory action in the human body. Hence, such a strong of the tissue in the human body is a bone. The bone has a cortical region surround the bone, and there is a trabecular bone marrow, which is most powerful than an iron rod. Even though sometimes iron rod breaks with a trauma or an injury, likewise such a strong bone also breaks is called fracture. So in children, when a bone fractures, it fractures like a green stick, the otherwise the green stick fracture. So what exactly happens in a children? This bone, one side of the cortex is completely breaks, the other side of the cortex bends. So that is called green stick fracture, because the green stick, when you try to break it, the one side of the green stick breaks off the half of it, and the rest of it bends according to the force. So in children, when there is a green stick fracture, there is a fracture to the growing end of the bone called epiphysis, are most important to diagnose properly with an X-ray and CT scan. So when you see there is a green stick fracture with the bending of the bone, then we must break the bent bone, correct the deformity, keep the fractured bone in a normal anatomical position, and then put a plaster or a KY or any other implant which helps to maintain the normal anatomical position till the bone unites. That is the way we treat the children's fractures. When there is a epiphyseal injury, that epiphyseal is undisplaced fracture, we can treat it with the plaster of Paris, or if there is a displaced fracture, then we should manually correct the deformity of the displaced fracture and fix it with the KY to stabilize the fracture and then heal properly. The adults, we see the complete fracture of the bone which is undisplaced or displaced, and then which could be closed or open. The displaced, undisplaced, we can manage by a way of plaster, by a way of splints, or by a way of surgery with the implants like screw, plate, rods, and any other implants. But in open injury, like a skin punctured out or cut opened with the bone exposed to the environment, has a possibility of environmental dust pollutants cause the infection to the bone. So hence, within the 6 hours of the injury, when the bone is exposed externally, must be treated immediately within 6 hours. Wash out the dust pollutants or whatever material which are from the external environment, and then fix the fracture with the external implant or internal implant. Hence, likewise, we should treat the fracture whether it's closed or open. So friends, there are the possibility of fracture because of the tumor, because of the infection, or because of the any diseases which leads to the fracture. So according to that, we should treat the cause of the fracture and treat the fracture again. So this is the way we manage the fracture in the human bodies.